point of Magpas and the volunteer doctors is to try and provide that hospital level resuscitation room at the roadside, and that's what we've tried to do here. And that sort of starts the ball rolling very early, so a lot of what the hospital would expect to do now, we've already done.
The Helimedics team members are drawn from a pool of trained physicians and trained paramedics. Historically, those physicians and paramedics were volunteers. They were always volunteers to begin with. Over the last 10 years, we've developed close working relationships with the ambulance service, with the NHS, with the RAF, to secure funding to provide for some employed staff to support the Helimedics service. So right now we have what perhaps could be called a hybrid arrangement, where some of our staff are volunteers, some of them are seconded to us as employed staff of other organisations, and some of them are actually employed by us through funding arrangements related to the NHS or the ambulance service, or indeed the Faculty of Pre-Hospital Care. It's really easy to forget that in the centre of all of this is a patient with critical care needs which are unmet. Our service is absolutely focused on meeting those needs, and we're trying to get this doctor paramedic team to the patient as quickly as possible and as safely as possible, and then treat them as quickly and safely as possible and get them to the right place as quickly and safely as possible. We've had very high standards over the years of quality and safety to assure this whole process, and we were delighted to become the first Healthcare Commission registered independent sector healthcare provider for pre-hospital critical care and retrieval, and we've now also become the first Care Quality Commission registered healthcare provider. As you know, the Care Quality Commission has taken over from the Healthcare Commission, and registration means a license to practice. It means that we comply with the standards for quality and safety that the Healthcare Commission have determined should be in place for healthcare providers in the United Kingdom. And we're very proud of the fact that we remain a CQC registered healthcare provider. The phrase HEMS stands for Helicopter Emergency Medical Services. It means delivery of medical care by helicopter. We undertake daylight and night-time HEMS services with the Helimedics teams, and we're the only CAA-approved physician staff night HEMS service in the United Kingdom. I just want to say that there are very few healthcare professionals who willingly and outside their work role subject themselves to the level of scrutiny and the level of assessment that we put our doctors and paramedics through, and it's to their credit that they put themselves forward for that and then continue to provide service, often at personal cost, not just free of charge, to circumstances and patients who are really the most critically ill and the most in danger of any aspect of healthcare practice in the UK. So they're a great bunch of people, amazing bunch of people.